Hello, my name is Olivia Keel, and I'm here to talk to you about hepatitis B virus. Hepatitis B, also known as hepatinovirus, is one of the most common liver diseases in the world and is a virus that attacks the DNA of the liver cells. There are actually 5 types of hepatitis: A, B, C, D, and E, but we're going to focus on hepatitis B today. In acute cases, body's T cells will locate and destroy cells that have been infected by HBV with the help of T cells and T helper cells. In chronic cases, T cells will actually become exhausted and can no longer fight the virus as efficiently, resulting in scarred tissue developing into cirrhosis. The way HBV is diagnosed is it can only be diagnosed through lab tests or a liver biopsy. Antigens from HBs are seen about 2 to 3 weeks after exposure, but it takes a few more weeks for HB core IgM antibodies to appear shortly after you see the symptoms. One thing is, though, HBV DNA can actually be seen from any point after infection. Whether you have acute or chronic HBV, the symptoms remain the same. A little more severe in acute, you'll see jaundice, fever, nausea, vomiting, even joint pain or hives. But with chronic hepatitis, it can result in liver failure, cirrhosis, and even hepatocellular carcinoma. And whenever you have hepatitis B, it will cause swelling and inflammation in the liver in both acute and chronic cases. Usually in acute cases, the inflammation in your liver can resolve on its own, but with chronic cases, you'll need treatment, and that usually involves antiviral medication and also interferon alpha and interferon or pegylated interferon. Risk factors include things that relate to blood, saliva, menstrual, or even seminal fluid. Those include mother to infant exchange during vaginal birth, also unprotected sex with one or more multiple partners, and even contaminated needles when sharing intravenous drugs, or if you got a tattoo, that tattoo needle could indeed be infected by HBV. With HBV, prevention is actually the best medication because the only 2 types that are curable are types A and C. Acute hepatitis can typically resolve on its own, but in chronic cases, it will be more necessary to have medical intervention. So to prevent HBV, the best way is to use condoms, don't share needles, and continue to be screened for STIs and STDs every 6 months to a year. I've also included a little short video over to the side to help better understand hepatitis prevention. In the United States, since 1991, a vaccine became available for all infants and children to be vaccinated for hepatitis virus. And since that, 8.5 out of 100,000 people were infected with hepatitis. And now, since the vaccine came out, 2.8 out of 100,000 people are infected. And truly, the vaccine is the only way to prevent hepatitis from taking your life. There are a few facts and myths about hepatitis. A couple of facts are almost 400 million people worldwide are infected with HBV, but only 67% know that they're infected. And from 1993 until 2003, the people of Ghana, Africa, saw a 63% increase in hepatitis mortality rate because of some main cultural and social beliefs. For one, they thought HBV was a punishment from the gods from touching people that were dead without their permission. And also they thought that they could be cursed or bewitched since they had HBV. And finally, they believed that HBV was caused from spiritual poison. So even if it was an uncontrollable circumstance, the people of Ghana from 1993 to 2003 believed that it was a spiritual poison and not a medical issue. And one myth that has come from European countries is that hepatitis can be contracted from consuming shellfish and other types of seafood. So if you don't want hepatitis, don't eat shellfish and seafood. But the fact is, there are some types of mollusks and sea creatures that eat by filtering the water around them. So things like cockles and mussels and clams or oysters can filter hepatitis A and C when eaten due to fecal matter in the water around them. However, those are curable types of hepatitis, and even if you wanted to avoid hepatitis, avoiding seafood is not the safest way to go. The best prevention is awareness, and in the United States, there are 2.2 million people that are infected with HPV, with only 25 to 50% actually knowing that they have the virus. And 95% of the people who develop HPV fully recover with little to no treatment, and 1 to 5 advance to chronic cases. However, if you have an infant and it becomes infected with HPV, 95% of those infants will develop to chronic HPV, and 40% of infants and adults of chronic cases will develop liver cirrhosis. So I actually included July 28th is World Hepatitis Day. So please spread awareness or even get tested on this day just to kind of bring some awareness to this and help people from suffering from a pretty severe STI. I'd like to bring some thank yous to Dr. Shaharudin for her article, and also Dr. Shrubs and Sheeble and the YouTube videos to help me bring all this information and research together. Thank you for listening to my PSA.